Good day, Assalamualaikum warahmatullahi ta'ala wa barakatuhu. Greetings of peace, everyone. So, welcome to our health assessment class, and today we will be discussing the module 3 of this subject, which talks about the review of systems part 1. Specifically, we will review the 3 major body systems that every nurse must be competent in assessing: the integumentary system, the HENMT, or head, eyes, ears, nose, mouth, and throat, and last but not the least, the respiratory system. So previously, we have discussed the introduction to health assessment. The very first thing, based on the framework, the very first thing that we need to do is to do a general survey and then take the vital signs. Now, the next that we have to assess is the head, which includes the eyes, ears, nose, the mouth, and the throat, and then the neck, and then it follows. However, in our discussion, I would like to reiterate that our discussion is not really the framework, but the review of systems, because we have to call this discuss it by system. Hindi ko siya I cannot pattern I will not pattern it in the framework. I will discuss it by system. Okay? So remember that health assessment is more than simply collecting information. It is a systematic process that enables us to identify the normal findings and detect abnormals early and formulate appropriate nursing intervention. Now, by the end of this discussion, you should be able to perform a comprehensive assessment of these body systems and distinguish between normal and abnormal findings. Okay. So now let's talk about the assessment of your integumentary system. Okay. Now, the integumentary system is the body's largest organ system, right? It is the largest organ in the body, the external largest organ in the body. It serves as the first line of defense against injury, against infection, against environmental hazards. When we assess this system, we do not only examine the skin, but we also assesses their different components, such as the hair, the nails, and the glands, which talks about the glands is either sebaceous gland or your sweat glands, because these changes in this structure may indicate underlying systemic diseases. For example, jaundice or yellowish discoloration of the skin due to liver problems. Okay, cyanosis. This may indicate inadequate oxygenation, while poor skin turgor may suggest dehydration. Therefore, a thorough assessment provides a valuable information about a patient's overall health. Okay, now, for the anatomy of the skin, let's have a quick review of your anatomy of the skin. It is composed of 3 primary layers. Okay, the epidermis, the dermis, and your hypodermis. Okay, now the function of the skin is for protection, for sensation, for the vitamin D production, and for the temperature regulation, and last but not the least, for excretion. This is for the excretion of sweat and oil in the body. Now again, the components of your integumentary system may include the skin, the hair, the nails, and the glands. So as you can see here, here's the layers of the skin. We have your epidermis, the dermis, and last here at the very low or inner part of the skin is your hypodermis. Okay. So again, this is the dermis, the green one, and then the epidermis, the dermis, and your hypodermis. Everything, okay, the function of the hair, okay, this insulates against heat and cold. This is one of the components, right? And then it protects us against ultraviolet and infrared rays. It also perceives movement and touch and protects eyes from sweat, especially our eyebrows in the head. Okay, and then protect nasal passages and ear canals from foreign particles because they are also located in our nose and in our ears. So here are just a quick review of the hair components. We have your hair shaft, hair root, hair bulb, okay, the medulla, the cortex, and the cuticle, the erector pili, or the smooth muscles that controls our skin, okay, the sebaceous gland, and your hair follicle wall. Okay. So hair shaft is a flexible strands of keratinized cells, and below it is or below the skin or located in your scalp area, especially sa head, is the root. The bulb is the base of the root and where hair is produced. The hair follicle is a group of cells that surround the root and bulb and gives hair different shapes depending on the genetic disposition of the individual. Okay, for the nail, it is a thin plate consisting of layers of dead stratum corneum cells that contain a very hard type of keratin. Okay, so you have here the free edge, the nail body, and the epinochium, and then the nail root and the nail matrix. So the nail body Okay, so the nail body is a visual part visual part of the nails. The nail root is covered by the skin, and the cuticles is a stratum corneum that extends into the nail body. The matrix continuation of the nail root and gives rises to most of the nails, and the nail bed is attached to the nail and distal to the nail matrix, and part of nail lunula is a part of the nail, and it's distal to the nail matrix. It is the whitish or crescent shape area and the base of the nail. So actually here in the nail body, you usually pinch this one whenever we want to check the capillary refill of your patient. Okay, so again, this is the inside part of your nails. Now, so let's proceed to assessing the skin. What are the things that we have to take note? So how would you describe the condition of your skin? Do you have an increased sweating at a certain times? Have you noticed any color changes in your skin? Or do you have any itching of your skin? Okay. So these are the things that we usually observe or we usually ask to our patients or to ourselves. Okay, so what are the things that we need to observe? First, observe the skin's overall appearance. Observe for cleanliness, and use also your sense of smell to determine body odor. Okay, so inspect skin color, inspect for uniformity of the color, and look for localized area of bruising. Okay, cyanosis, the bluish discoloration due to lack of oxygen, pallor, okay, jaundice, erythema or redness, petechiae, rashes, vitiligo or albinism. So this is actually your stages of bruising. It starts at red patches, and then it will become purple, and then lastly it will become the edges will become yellow, and then it will dark brown. Okay, so actually this is a type of your cyanosis. Okay, so this is a pallor. Okay, usually we check our paleness of the patient in our conjunctiva or in the palate. Okay, jaundice or the yellowish discoloration, and this is the erythema. And we have here the petechiae, rashes, okay, and this is vitiligo or albinism. So these are just examples of abnormalities or any skin conditions that we can check, okay, localized areas. Next is inspect and palpate the skin's texture, the temperature, noting its thickness and mobility. So how do you determine the client's skin temperature? So usually we use the dorsal part of our hands, okay, in order to detect the, what they call this, detect the body's temperature, and then we have to compare it on both sides. Okay, so body temperature reflects the balance between the body heat and the heat lost from the body, and is measured in heat units called degree. So it can be Fahrenheit or Celsius. Okay, so there are two kinds: core temperature and the surface temperature. Now, your core temperature is the temperature of the deep tissues of the body, while the surface temperature, wherein we can actually assess this one by using the dorsal part of our hand, is the temperature of the skin, the subcutaneous tissue, and fat. Now, we have different they call this equipment that we use to assess these two types of temperature, the core and the surface temperature. So again, this is the balance. Okay, the heat, anything that produces heat. Okay, we have basal metabolic rate. If it's increased, it increases our heat production. When you're exercising or shivering, when there is an increased secretion of your thyroxine, epinephrine, and norepinephrine, or if you are experiencing fever or inflammation, then our body produces increased heat, while our body losses heat when there is a radiation, conduction, convection, and evaporation. Let's discuss this later. Okay, so factors affecting the body's heat production. We have your increased metabolic rate, muscle activity, the thyroxine output, the epinephrine, norepinephrine, and sympathetic stimulation or stress response, and if there is fever. Okay. Now, for the heat loss, okay, how do we lose the heat in our body? First, it can be through radiation or the transfer of heat from the surface of one object to the surface of another without contact with between the two objects. Okay, so it radiates, no? The fever or the heat radiates throughout the two objects. Okay, conduction is the transfer of heat from one molecule to a molecule of a lower temperatures. Example, if you touched a hot surface and then you will hold into cold temperature, then you will transfer that cold temperature will transfer into your hand. Convection is the dispersion of heat by air currents, such as during or exposed to AC or air conditioning. And then last but not the least is through evaporation. It is the continuation or continuous vaporization of moisture from the respiratory tract and from the mucosa and from the skin. So when we sweat, okay, when we talk, okay, and when we sneeze, or everything that we do that may result to sweating or increase or continuous vaporization. Okay. So let's talk about the different alterations in the body temperature. I know you're familiar with this one, but this is just a review. So the normal body temperature is 36 degrees Celsius to 37.5 degree Celsius. Okay, and you can use the Fahrenheit, 96.8 degree Fahrenheit to 99.5 Fahrenheit. So we have different types of fever. We have your intermittent fever, the remittent fever, the relapsing fever, and the constant fever. Now, for your intermittent fever, the body temperature alternates at regular intervals between periods of fever and periods of normal or subnormal temperature. So here in this type of fever, the fever goes on and off. Okay, for 2 days you have fever, and then it will normalize. It will go back to normal, and then afterwards, the next day, you will still have your fever. So that is what we call intermittent fever. Now, for the remittent fever, it has a wide range of temperature fluctuation. However, it remains. It has it may go back to the normal. However, the difference or the fluctuation from the normal to the abnormal is really wide compared to your intermittent fever. Now, for your relapsing, short febrile periods of a few days are interspersed with periods of 1 to 2 days of normal body temperature. Now, for your constant, we have the body temperature fluctuates minimally but always above the normal. So let's say 37.5, 36, 37.6, 37.8, then 38, 39, then go back to 37.5. So that is still above the normal body temperature. So that is a constant fever. Okay. So let's talk about hypothermia, or if the core body temperature is below the lower limit of the normal. So there are three physiological mechanisms of hypothermia. If you experience excessive heat loss, that's why you experience hypothermia. If there's an inadequate heat production to counteract heat loss, or impaired hypothalamic thermoregulation, then there's a time that you will experience hypothermia. Okay, so here are the things that sites, okay, and with the equipment that we can use in order to check the different body temperature. It's either core temperature or surface temperature. For the oral, the advantages of this one is for accessible and convenient. Now, this is actually a core temperature, oral. So, for the rectal, it is the reliable measurement because it can also check the core body temperature of your patient. For the auxiliary, this is usually the safe and non-invasive, and it's actually the surface body temperature. Okay, so these are just example of the equipment that we use to check for the body temperature of your patient. This is for the rectal, okay, and can be for oral, and then we have your for auxiliary. Now, for the tympanic membrane, it is readily accessible and reflects the core temperature very fast. So this is the example of your thermometer for tympanic membrane. Now, for your temporal artery, it is a safe and non-invasive and very fast. So this actually checks the surface temperature. Okay, so just like that. So again, it depends on the hospital availability of the equipment. Okay, it may differ from one hospital to another hospital, so just use the regular body temperature equipment, okay, that is available in your hospital. Now, for next is assess edema if present and describe it. So we have here the grades of your edema. Okay, especially actually you check the edema on the leg part of the patient, or where is there is an increased prominence of bone. Okay, so you can easily check there the edema status of the patient. So positive 1 if your finger nail is dipped into 2 millimeter, and then 2 positive if it's 4 millimeter, and then 6 millimeter 3 positive, and 4 positive if it's 8 millimeter and above. Okay, so here's an example of a pitting edema. So when we say pitting edema, it is a type of edema that causes an indentation or leaving a mark after putting a pressure through your fingernail. Okay, so measure the circumference of the extremities using tape measure, especially if there is an edema, and inspect, palpate, and describe the skin lesions for characteristics, pattern, location, and distributions. Okay, now we have here different lesion shapes that we can observe from the skin of our patients. We have the discoid or round or oval. It is the annular or circular with central clearing. We have your bullseye. So annular with central internal activity. So we have also for the lesion configuration. It can be through the lesion can be in discrete pattern. Okay, we have your grouped or clustered, we have your confluent or not visible or palpable, and we have your dermatomal or it line or an arc and follow a dermatome. For the lesion distribution, it can be generalized or it can be regionalized or localized, which is in the specific area. So it can also be scattered or dispersed. We have exposed area, and then we have your intertriginous, or wherein the skin comes contact in with it itself, okay, especially in the armpits, okay, and our elbows. Now, we have here different types of skin lesions. We have pustules. It is a small pus-filled lesion. We have your cyst, a closed sac in under the skin. We have also your nodules. It is a raised lesion detectable by touch. And then we have here your wheal, a raised reddish area, commonly itchy. We have also your fissure, a painful crack-like lesion. And then we have your bulla, a large fluid-filled blisters. We have here your macule, small discolored patch. This is actually commonly seen in measles, okay? We have your vesicles, a small fluid blisters, okay? This is commonly seen also in chickenpox, okay? And then we have here your papules. So actually, it is also this type of skin lesion is also seen in they call this measles, because measles do have maculopapular rush, okay? And then we have your ulcers, okay, a crater-like lesions, okay? So stages of pressure ulcer. So we have here stage 1, the stage 2, the stage 3, and the stage 4. Actually, one of the common things that we have to or important things that we have to prevent for our bedridden patient is for them to not experience pressure ulcer, because if the patient can experience pressure ulcer because of being a bedridden, that only means that the nurse what they call this neglected the patient, because we can prevent this type of pressure ulcers by doing positioning, okay, every 2 hours or every 1 hour, okay, allowing the patient to sit down or use assistive devices from time to time to avoid pressure ulcers in their back, okay? So, common skin disorders that we can see from our patients, we have contact dermatitis, we have your psoriasis or psoriasis, we have your urticaria, and we have your scabies, we have your herpes zoster, and we have also your tinea corporis. Okay, so observe and palpate the skin moisture by pulling the skin. Okay, this is how we check the skin turgor or skin moisture of the patient. Okay, and now for the assessing the hair, how would you describe the condition of the hair of your patient? Okay. How often do they wash their hair? And then have you noticed any hair loss, okay, or alopecia? So observe and note the distribution and quantity and texture and color of the hair. Inspect the evenness or growth over the scalp. Normally, it is evenly distributed, okay? But abnormally, they may experience alopecia areata. Example, this. There's a patches na no hair or hair loss, or the patient may experience hair loss. Now, inspect also the hair texture and hair oiliness. Inspect the hair thickness and thinness, and note presence of infections or infestation. So, any lice, okay, or dandruff in the scalp, okay, in the hair. So, abnormal may include tinea capitis, folliculitis, or furuncle. Okay, yan. And then we have your inspect for amount of body hair. It's body hair, not hair. Okay, sorry for the typographical error. So, abnormal is hirsutism. Okay, there's an increased hair distribution in the body. And then for the nails, okay, let's proceed to the nails. How would you describe the condition of the nails now? Okay. Have you been ill recently? Okay, because we can actually check if you have experienced dehydration or cardiovascular diseases by looking at the nail of your patient. Okay. So examine the nails for color, for shape, the thickness, the consistency, the contour. The nail color should be pink in light skin and brown in dark skinned people. The nail surface should be slightly curved or flat, and the edges are smooth and round. Okay. So this is actually the normal and abnormal, a comparison of the normal and abnormal nails. So you can see we have here about, okay, the description of different nail types. Okay, so just like that. And these are abnormal nails. Okay, there's whitish parts, and then we have here parang red spots, and then here is increased yung nails, and then we have here no nails at all, and we have also here there's a infection around the nail matrix. Okay, now let's proceed to your assessing the skull, face, eyes, ears, nose, mouth, sinuses, mouth, and pharynx. This is the complete assessment of your HENT, or head, eyes, ears, nose, and throat. So we're done with assessing the integumentary system. However, in assessing the integumentary system, all throughout, by following the framework of your assessment, which is general survey, vital signs, the head, neck, okay, the chest, okay, the abdomen, and then the upper extremities or the arms, and then the reproductive system, and then or the genitalia, and then last but not the least is the lower extremities. All throughout, while you assess that specific body parts, you also check automatically for the integrity of their integumentary system or condition of their skin, their hair, their nails, and their glands. Okay, so now let's proceed to your assessing the HENT. Okay, so head, eyes, ears, nose, and throat. So let's proceed first to your assessing the head. So these are just the review of the parts of their brain, okay, or our head. So here is a model that shows the different lobes, the bones, okay, and the part of our head. So we have the zygomatic bone, we have here our jaw bone, we have your skull, and as you can see in the skull, it is divided, or there are different parts. We have your frontal, the parietal, the temporal, and we have your occipital area. Okay. So we have different parts. Okay. So what are the things that we need to inspect in our skull or in face? So inspect the skull for size, shape, and symmetry. Normally, it is normocephalic and it has smooth skull contour. Abnormal may experience a macrocephaly or increased head circumference, or microcephaly, decreased head circumference. So you may also inspect the facial features or the structures or facial distribution. Normally, it should be symmetric or slightly asymmetric features. We especially if there is a palpebral features also is equal in size. So actually our body, or you can observe that our body parts, or both left and right of our body, is slightly asymmetrical. If you look closely to our body parts, okay, it is slightly asymmetrical. That's why there's no perfect in this world, because our body parts is normally asymmetrically. However, it will become abnormal if the asymmetrical or asymmetry is very, 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 very visible. Okay, so abnormal examples of patient, okay, that can be seen, or abnormalities that can be seen in our patient: exophthalmos, myxedema, or moon face. Now for the note for symmetry of facial movement. This where you ask the patient to puff their cheeks, to smile, to frown, and then you smile with the teeth or without teeth. Okay, so you have to check if the movement is symmetrical. So abnormalities may include ptosis, tics, or tremors. So also palpate the skull for any nodules or masses. Check for any local deformities from trauma. Okay, so again, this is the normocephalic. Okay, this is a smooth skull contour. So this is an example of hydrocephalus, but also can be an example of macrocephaly. Okay, so these are just examples of local deformities from trauma. May nagkaroon ng they had experienced a depression. Okay, example, yan. And then we have also here structures of a patient who experiencing or who do have a mixed edema. Okay, this is an example of exophthalmos earlier, the one that I mentioned earlier. And then we have inspect the eyes for any edema or hollowness or periorbital edema. Yan. So we have also sunken eyes. So usually this is seen commonly in children who experiencing dehydration. So this is actually a warning sign. If you see this in a child who experiencing increased fluid loss, then you have to go to the nearest hospital for the child to be confined, because it tells a lot that the dehydration may be going to the brain. Okay, so note for any facial movement or abnormalities. This is what we call the ptosis. The other one, okay, there's an clear or visible disalignment of the face of the patient. We have the tics or tremors. Now, for the assessing the eyes, again, eyes is used in for sense of vision, right? So these are different parts of the inner eye. So we have your inner canthus, the lacrimal sac, the lacrimal gland, the nasolacrimal duct, okay, the bony orbital margin, the lacrimal gland, the outer canthus, the sclera, the iris, the pupil. These are just the things or structures that you need to inspect in the eyes of your patient. Okay, for the internal examination, we have here the ciliary body, the optic disc, okay, the retina, the choroid, the sclera. Okay, now, so how do we check the eyes of the patient? Now, we have here in the external and internal eye examination, and afterwards, you will perform visual acuity test. Now, in performing visual acuity test, we use the Snellen chart to check if the vision of the patient is 20/20, which is the normal visual acuity of a adult patient. So here, we use the Snellen chart. You place the patient at a distance of 20 meters away from the chart, so that by asking them to read the letters, then you will check at the side of this line, you will check the distance or the visual acuity of your patient. So yeah. Then next is the assessing the visual field. How do we assess the visual field of the patient? So visual field, it can be two: the central field of the patient or the peripheral field of the patient. So we do assessing this one through your using your fingernails and the 6 cardinal areas of gaze, by asking the patient to follow your finger and then without using their head, and then you point your or you hold your fingernail into the upper right, okay, middle right, okay, lower right, and then lower left, far left, and upper left. So what are the common refractive errors of lens in the eyes? Okay, so we have here myopia or nearsightedness. We have hyperopia, farsightedness, presbyopia or the loss of elasticity and seeing close objects. This is actually common sa mga old age, okay? We have astigmatism or uneven curvature of the lens. Now we have here also the common inflammatory visual problems, okay, that may be seen or checked in the patient. So we have here conjunctivitis, or the inflammation of the conjunctiva, or bulbar or palpebral conjunctiva. Dacrocystitis is the inflammation of your lacrimal sac. So lacrimal sac is the one that produces tears. Now, if it's simply inflamed, then we cannot produce. It's either you produce too much tears, or you stop producing tears. Then we have here rhodulum or sty. The hair follicle and glands at the eyelid edge is inflamed. And then we have the iritis, or inflammation of the iris. We have cataract, the opacity of the lens, generally occurring over 65 years old. However, in the new or in recent, okay, na mga recent datas, this is very common in patients who experience diabetes mellitus. So as early as, again, it's common at over 65 years old. However, those patients who experiencing or who is having diabetes mellitus may experience this type of visual problem. Okay, so we have here your glaucoma, or the disturbance in circulation of aqueous fluid, and that causes increase in the intraocular pressure. Mind you that we have actually, okay, if you can still remember in your anatomy and physiology, we have water, actually a fluid, aqueous fluid in our eyes to maintain, because there's no bone structure that holds the eye in place. So who holds the eyes in place is the fluid inside the eye. So now there's what we call the intraocular pressure that maintains the position of our eyes. However, if there is an increased pressure of your intraocular, then the movement or the position of the eye may change because of that increase on the pressure. So inspect and palpate the eyes. Okay, so after you check the visual acuity, then you proceed to internal eye or external eye examination. So you inspect and palpate the eyes. You check for the eyelids. You check the color of the irises, their corneal reflex, their conjunctiva and sclera, and perform the pupil inspection, wherein you shine a light to the pupils of the patient, and you check if it's equally round and if it's reactive to light and accommodation, if it's narrowing, okay? If the size of the pupil narrows while you shine a light directly, then that's the perfect, that tells you, it does tell you that the pupils are equally round, reactive to light and accommodation. So these are the different sizes of our pupils, maybe a 6 millimeter to 30 millimeter size. And then assessing the eye muscle function by checking the corneal light reflex and cardinal positions of gaze. So you check also the extraocular movement, okay, by checking the abducens. I have your oculomotor, and we have your trochlear. Okay, these are the one that what they call this, controls the extraocular muscles. Okay, now let's proceed to your assessing the ears. Again, assessing the ears is a special organ used for hearing, usually, and also balance. So the two things that very important that we assess here is the ability of the patient to hear sounds and interpret sounds, and the ability of the patient to balance themselves. Okay, so observe the ears for positions and symmetry. Inspect the auricle for any lesions, for any drainage or nodules or redness. Inspect also the opening of the ear canal, noting any discharges, noting any redness, noting any odor or presence of nodules or cyst. So you can also perform an internal otoscope examination, and then hearing acuity test to check for the sense of hearing of your patient by performing the two, what they call this, tuning fork test, the Weber test, and the Rhine test, which actually the Weber's test assesses the uh, bone conduction of sound, and then the Rhine's test is a comparison of your air conduction of sound and bone conduction of sound. Now, for the nose, mouth, throat, and neck. Okay, so let's proceed with that. So for the nose, again, these are your nasal cavity. So nose is responsible for two things: inhaling oxygen, and also it also removes mga waste products that we can inhale, or that can make our air dirty, no? So it also humidifies the air that we breathe in. So this is actually part of your respiratory system. Now your mouth is actually it has two functions actually. It is also included in the respiratory system. It can act as where we can inhale and exhale our air, and then for the mouth, it can also be used as a digestive process, okay, by chewing, by swallowing food. So actually, it is a part of the digestive system. However, it can also be a part of your respiratory system, wherein we also expel and inhale oxygen through mouth. Okay, now for the sinuses, we have here the different parts of your sinuses. We have your frontal sinuses, we have your ethmoidal sinuses, the sphenoidal sinuses, and your maxillary sinuses. Now, this sinuses protects our nasal passages, or the nasal cavity, from any bacterial or infections. So by the time that it is inflamed, or by the time that is very sensitive, then it may tell you that the patient is experiencing exposure to allergens or pathogens. Okay. Now for your throat, we have here the very important thing that we need to check here in the throat, other than your larynx, is the thyroid gland of the patient. Okay. Now we have here the different lymph nodes located in the neck. Okay, actually the one who has many lymph nodes present is actually in the neck area. Why? Because they have to protect our brain. They have to assure that there is no pathogen that can go to the blood-brain barrier, or going to the brain, that may cause infection, because brain is very important in our body. Okay, so let's proceed in assessing the nose. So what are the things that we need to observe and check and inspect, palpate? Okay, so observe the patient's nose for position, the symmetry, and color. So inspect the external nose for any flaring or discharges from the nares. Kasi once the patient experiencing nasal flaring, then he or she may experience difficulty of breathing. Okay, so inspect or lightly palpate the external nose to determine any areas of tenderness, masses, and displacements of bone and cartilage. Determine the patency of both nasal cavities, and inspect the nasal cavities using a flashlight or nasal speculum for presence of any redness inside the nasal cavity, any swelling, any growths, and discharges. So you have to check if it's mucosa red, edematous, or if it has pus or epistaxis. Okay, so these are just abnormalities, okay, that we may observe to our patient. So this example of your epistaxis, no? About presence of lesions such as polyps is example of your polyps. And inspect also the nasal septum between the nasal chamber. It should be in middle area, or in the middle area, and it usually divides the two nares into two. Okay, so also check for the or palpate the facial sinuses. Again, the frontal, ethmoidal, sphenoidal, and the maxillary. So usually, common is the maxillary and the frontal sinuses for any areas of tenderness. Okay, so I hope it's clear. Again, if you have questions, clarification, if my discussion is too fast, do not hesitate to comment in the video so that I can actually improve my discussion. Now, let's proceed to your assessing the mouth and throat. So these are different. There are different problems that may affect the mouth and throat, okay, that you can actually observe in an actual patient. So we have dental caries or cavities, example, like that. We have also your periodontal diseases or pyorrhea, okay. The teeth and the gums are damaged, and the patient may experience tooth losses, okay, because the gums cannot hold the teeth anymore. And then we have the plaque, an invisible soft film that adheres to the enamel to the surface of the teeth. Yan, nagiging yellowish. And then we have here the tartar, a visible hard deposits of plaque or dead bacteria that forms at the gum lines. So actually, it provides it actually causes the teeth to have spaces, and you thought that there's no spaces. However, there's a space because it has been deposited with tartar. So that's why it is very important that we clean our teeth every 6 months, but some advises every 3 months, depending if the patient has dental prosthetics, or example, they have dentures, they have braces, dental braces, or retainers, so they have to do or to comply cleaning, dental cleaning. Now, we have gingivitis, a red swollen gingiva, yan, redness of your gums, okay, and then either nagbe-bleed, okay, and then we have also your glossitis or inflammation of the tongue, and then we have here stomatitis or inflammation of the oral mucosa. So naging red, there's some redness over the oral mucosa. And then we have also herpes simplex type 1, just like this, okay. So it may caused by oral sex or kissing with the patient infected with herpes simplex, okay. And then we have your angioedema or the inflammation of the lips, okay. And we have leukoplakia or whitish spots in the they call this tongue area. And then we have your candidiasis. So it is whitish spots in the overall the oral mucosa. So the buccal area, the tongue, and even the hard palate do have white patches. Now, for the lips and oral mucosa, inspect the lips for symmetry of color, the contour, and the texture. Normally, it is pink in color, soft, moist, and has smooth texture. So, abnormal, pallor, cyanosis, blisters or localized swelling or crust or scale. So, actually, by checking the lips, we can also check the hydration of the patient. If it's dry or cracked, it may signify us, or it might tell us that the patient is dehydrated. Inspect and palpate the oral mucosa for color, the texture, and presence of lesions. So normally, it is uniform in pink, and it may be freckled brown pigmentation for dark-skinned clients. For abnormal, it may pallor. You check for any pallor, leukoplakia, red, or bleeding. For the gums and teeth, inspect the teeth and gums. For an adult, it should be 32. Okay, you check for any presence of veneers, presence of dental dentures, braces, retainers. You have to count that, or any they call this implantations. Okay, or dental corrections that was implemented in the mouth of the patient or oral cavity of the patient. So it should be smooth and white, shiny tooth enamel. And then for the abnormalities, you may check for any missing teeth, and then you have to identify what part of the teeth was missing, ill-fitting dentures, and brown and or black discoloration of the enamel. Now, for the tongue, inspect the surface of the tongue for position, for color, and texture. So, normally, the tongue is located in the midline, pink color, and smooth, and has no lesions. So, abnormal, it may be deviated from the center, red tongue, dry, and fury tongue. So, inspect also for the tongue movement. You ask the patient to move their tongue up and down, side to side, or move against a tongue depressor. So normally, it moves freely and no tenderness. And if there is a restricted mobility, then that's the time that it's abnormal. Now, the palates, inspect the hard and the soft palate for color, for shape, for texture, for presence of bony prominence. So the part that has a bony prominence is your hard palate. That's why it's called hard palate. Now, normally, it is light pink, smooth, and soft palate. Lighter pink and lighter pink if it's hard lighter pink, okay, and the hard palate and more irregular in texture because it is bony prominent. And this color you can also hear again the one that I mentioned earlier. Pallor can be assessed through by checking your conjunctiva and the palate. So if there is a jaundice or pallor or exostosis, just like this one, okay, you have to check also that. And then for the uvula, inspect the uvula for position, for mobility while examining the palate. So how do you inspect the uvula? By asking the patient to say ah, and then makikita natin or the uvula rises. So midline or soft palate, and abnormality if it's deviated to one side due to trauma, due to tumor, due to immobility, or due to tonsillitis or the inflammation of your tonsils, because we do have tonsils in our oral cavity. Now for the oropharynx, inspect the oropharynx and for color and texture. It should be pink, smooth, and or posterior wall. If it's reddened, edematous, or presence of lesions, then that's the time that it would tell you na exposed to inflammation yung oropharynx. Now, inspect the tonsils for color, discharge, and size. It should be pink, smooth, no discharges, or normal size, or not visible. So, if it's visible, meaning it's inflamed. Okay, so if there's a presence of discharge or swollen tonsils. So this is actually the grades of the tonsils. So we have here the tonsils 1. Okay, grade 1, the tonsils hidden within the tonsil pillars. Now 2, if it's extending to the pillars. Now 3, if it's going near the uvula, and 4, if it obstructs the airway. So this 2 and 3 actually is very call this dangerous because it can block our airway and cause difficulty of breathing to our patient. Now, elicit also gag reflex by pressing the posterior tongue with the tongue depressor. By assessing the gag reflex, you also check the vagus nerve and the ability of the patient to swallow. Okay, so now let's proceed to the assessing the neck. Okay, now in assessing the neck, we have to check, we use the inspection and palpation. We inspect the neck muscles for any abnormal swelling or masses. So normally, the muscle should be equal in size and the head is centered. Observe also for head movement, if it's coordinated, if it's smooth movement with no discomfort. So if it may be abnormal if there is a presence of muscle tremor, may spasm, stiffness, or limited range of motion. Assess also for the muscle strength of the neck by asking the patient to move in different directions and then provide resistance against it. By that, you can check for the muscle strength of the patient. Now also, a very important thing that we need to assess also in the neck is to check and palpate the lymph node. So for any enlarged lymph node, because if there is an enlarged lymph node, it may tell you a problem such as a tumor, okay, or cancer, or infection. Okay, so it only tells us that there is a problem. Okay, now we have here the different Lymph nodes located in the head and the neck. We have in the head the occipital lymph node at the posterior base of the skull, the post-auricular or the mastoid behind the auricle of the ear, pre-auricular in the front of the tragus of the ear. We have your submandibular or submaxillary along the medial border of the mandible or your jaw, and then submental behind the chin. Behind the tip of the mandible or under the chin. For the neck, we have your superficial anterior cervical or tonsillar along the mandible, anterior to the sternocleidomastoid muscle. We have your posterior cervical along the anterior aspect of the trapezius muscle, the deep cervical under the sternocleidomastoid muscle, and supraclavicular above the clavicle in the angle between the clavicle and the sternocleidomastoid muscle. So again, the lymph node should be small, soft, and not tender. Now, if it's enlarged, palpable, and possibly tender, then that's an abnormal sign. For the trachea, you should palpate the trachea for lateral deviation. It should be placed centrally midline of the neck. Any deviation to one side may tell us that there is a thyroid enlargement. Now, for the thyroid gland, inspect the thyroid gland. It should be not visible on inspection but can be palpated. So, if it's visible on the inspection, then that's an abnormality. Example like this. We have this condition, thyroid goiter. Okay, so palpate the thyroid gland for smoothness. So it should be small, smooth, and not tender. So tender, not fully, and if it's tender and not fully movable, then it's abnormal. Now let's proceed to your assessing the thorax and lungs or assessing the respiratory system. So I hope you have understood the topics that I have discussed in assessing the integumentary system and assessing the head, eyes, ears, nose, throat, and mouth. Now, let's proceed to the respiratory system. Again, respiratory system is divided into two, the upper and the lower. Now, the upper includes your external nose, the nasal cavity, the pharynx. Now, the larynx, the trachea, and the bronchi, and the lungs is your lower respiratory tract. So, we have here the 5 lobes of the lungs, 3 sa right, and then 2 lobes at the left, because we give enough space for the heart at the left side of the lungs. Okay, so again, respiratory system is responsible for they call this
talking you, mama.
Inhalation or respiration and exhalation. Okay, so the process of inhaling oxygen and the process of exhaling carbon dioxide is one of the responsibility of the respiratory system. Also, the respiratory system helps the cardiovascular system or work hand in hand with the cardiovascular system to provide oxygen all throughout the body, because again, oxygen is important in the survival of a human being. Okay, so let's proceed to again, these are the thorax line or the division of your thorax or chest area. Okay, so check for cramp. Ano po tong cramp? What's this cramp? So C stands for chest wall symmetry. Okay, check for the symmetry of the chest wall. You check for the anterior and posterior wall of the chest. So normally, the adult thorax is oval and elliptical. Again, yan. Actually, the anterior posterior diameter is mostly increased compared to the posterior area. And then abnormalities, we have here the barrel chest or increased anterior posterior diameter, just like that. Okay, we have also the funnel chest or pectus excavatum, the depressed lower sternum, just like that. And then we have here the pigeon chest or pectus carinatum, anteriorly displaced sternum. Okay, parang beak of the pigeon. And then we have also your thoracic kyphoscoliosis, raised shoulder and scapula. It's a combination of they call this hunchback and scoliosis. That's one. Kyphoscoliosis. Scoliosis actually is the S curvature of the back or chest. So If there's a hunchback, that is kyphosis. So the combination of these two, it's a hunchback and S curvature. So again, this is the normal. We have the barrel chest. Here's the scoliosis, the pectus carinatum, the pectus excavatum, and your kyphosis. Now, R stands for respiratory rate and pattern. The normal respiratory rate of an adult is 12 to 20 cycles per minute. However, it may differ from age group. So you have to check the different age group and identify if it's normal or abnormal respiratory rate. Okay. Now, A stands for accessory muscle use. So if the patient is using the accessory muscles, then you have to check the breathing pattern of the patient, because the patient may experience difficulty of breathing. That's why they use their extra or the accessory muscles. And then M for masses or any scars which you may palpate in the chest area. And P stands for the paradoxical movement of the chest. Their movement, the ability of the patient, or the rise and fall of the chest of the patient. Okay. Of the chest of the patient, sorry. So palpate the anterior thorax. It should be smooth, warm, not tender, and in slight palpation. However, you have to take note that when you palpate the anterior thorax, you may also palpate the breast of the female patient. So either way, you can start with assessing the breast of the patient, and then you may proceed to assessing the chest. Or after assessing the chest, you can also assess the breast, because it's on the one area. So that on the next time, you will not go back again to the chest area, because you have already assessed the breast area of female patient. Okay, so abnormality, tender, if my chondritis. We have rib or vertebral fractures or sore muscles caused by coughing, bulging, crepitus, or lesions. Palpate also the posterior thorax. It should be intact, uniform temperature. The chest wall is intact and no tenderness. Check for any skin lesions or areas of hyperthermia, lumps, bulges, areas of tenderness, and movable ribs. Okay. Palpate also the posterior chest respiratory excursion, like this one. So you check if your thumbs move along while you inhale and exhale, or the patient inhales and exhale. So the normal is the full and symmetric chest expansion. The thumb separates 3 to 5 centimeters during deep inspiration. Now, if it's decreased than 3 to 5 centimeter, then there is a decreased chest expansion while doing the deep inspiration. So the palpate and auscultate for the chest for vocal or tactile fremitus. You by doing this test, you ask the patient to say the word 99, and then you will palpate for the vibration. So this area, we have A, B, C, D, E. Okay? We have the anterior and we have your posterior part. Now, it should be equally vibrating on both sides. So again, we have to check again bronchophony. Okay, we can check the tactile fremitus by performing the bronchophony, wherein you ask the patient to say 99 a word. We have also egophony, wherein you ask the patient to say the letter E. We have the whispered pectoriloquy, if you ask the patient to say the numbers 1, 2, 3, and for the abnormalities, if unusually loud yung bronchophony 99, then that's abnormal. If the letter E sounds like letter A, is abnormal. And if the number will be loud and clear by checking and auscultating, while auscultating the chest, then that's abnormal. Now, percuss the chest. How do we percuss? On the same manner how we do palpation and palpation and auscultation, we also do the percussion in the same pattern. Okay, so percuss the chest, normally it should be resonance. Okay, because air filled kasi yung lungs natin, so it should be resonance. Now, flatness over the scapula because it is a large bone. Okay, and dullness over the diaphragm and liver because it is a muscle or a tissue. Okay, for tympani, should be at the stomach, it should be tympany. Now, abnormalities such as hyperresonant may tell you that the patient has a lung problem, emphysema, acute asthma. Dullness over the lungs which may mean that there is a decreased air or atelectasis pneumonia. Okay. So, percuss for diaphragmatic excursion, okay, movement of the diaphragm during the maximal inspiration and expiration. So, you have to check from resonance to dullness. So, the normal excursion again is 3 to 5 centimeter, while for men is 5 to 6 centimeter, because actually they have wide chest compared to the female. Now, diaphragm is higher on the right side compared on the left side. And if it's restricted excursion, then the patient may have lung disorder that causes them to lessen or have poor inspiration or breathing pattern. So, auscultate the chest using diaphragm of the stethoscope. What do you check? The lung sound. So, we check for abnormal and normal lung sounds. Normal, we have here the normal lung sounds. First, for the trachea. Over the trachea, you have to place the diaphragm there, wherein you can auscultate a harsh, high-pitched. Okay, for bronchial, a loud, high-pitched sound above the clavicles on each sternum. And then we have your bronchovesicular, medium in loudness and pitch, usually next to the sternum, between the scapulae. And then we have your vesicular, okay, which is a soft, low pitch in the remainder or base of the lungs, or wherein we can auscultate the vesicular sound. Now, we have abnormal sounds, okay, if it's auscultated to their patient, then that's an abnormal sign. So, fine crackles or rails is a soft, high pitch or a cracking or a popping sound. This may tell you that there is a, what they call this, secretions over the airway. Then we have coarse crackles, a loud, low pitch, a bubbling or gurgling sound. We have wheezes, a musical high-pitched sound or a whistling sound. So, pag merong wheezes or if there's a wheezes, then it may tell you that there is a narrowing of the airway. And then we have also the rhonchi, the low, musical low pitch such as snoring or moaning sounds. And we have also the friction rub, wherein there's a creaking sound that is produced of the cavities of the lungs. Okay. So, next, inspect the breathing pattern or the respiratory rate and rhythm. Normally, it's eupnea or normal breathing. So, effortless respiration. Okay? So, that's the normal. However, take note, if we check for the breathing pattern of the patient, do not tell them, because consciously, we can control our breathing pattern. That's why you never tell your patient to check their breathing pattern. So, you just observe the rise and fall of their chest, and if there's a sign of nasal flaring, if there's a sign of mouth opening to gasp for air, then you have to check that one. Now, bradypnea, abnormal breathing pattern is bradypnea, slower than normal. Tachypnea, a rapid, shallow breathing. Apnea, absence of breathing or period of cessation of breathing. Hyperpnea is the deep and fast breathing. So, we have cosmos respiration, a severe rapid breathing without cessation, or what we call labored breathing. This is actually common when we do exercise. So very fast breathing and without cessation because we gasp for air. And then we have Kind-Stokes respiration, a progressively increasing respiration with a period of apnea or absence of breathing. And then Bayet's respiration is a rapid deep breathing with abrupt pause between each breath. So, example lang natin, ganun. Para siyang, actually, one of the examples that we do give is the breathing of a dog. Okay, diba? When they breathe, diba? So, it's an example actually of a Bayet's respiration. So, I think that ends my discussion. So again, by the way pala, I would like to reiterate also that the pattern and rate is different. The rate can be normal, however, the breathing pattern of the patient can be abnormal. So let's say they have 20 respiratory rate, okay, 20 cycles per minute. That's normal, right? However, the pattern is abnormal. Let's say it's in 20, but there is pause. There is a we call this a cessation between breaths. So the pattern is abnormal, but the rate is normal. So it can happen to patient. That's why, how do we check for the breathing pattern of the patient? Through an ECG monitoring, okay, cardiac monitor. It's actually, there's also an area wherein you check for the breathing pattern of the patient. Okay, so I think that would be all for my discussion for this module. Again, this is the first part of your respiratory, assessing the review of system. Okay, so again, please, they call this, don't be parang questionable na, why is it the discussion is through system? The discussion, okay, of the head to toe assessment is, my discussion is focused on on the systems, not based on the framework. That's why I provided the framework for you to be guided, because the discussion that I will be having is by systems, okay, so that the discussion is more deeper and more specific. Okay, so I think I hope you have understood the topics that we have discussed. If you have any questions, clarifications, please do not hesitate to message, to beep me up. Again, if you have difficulty taking the quizzes, you can ask or just message if there is an difficulty, so that I can double check it. Maybe there is a problem with the application, or there's a problem with the signal. Okay, so thank you for watching this video and have a nice day.